And joining us now to discuss this more is President of the National Birth Equity Collaborative, Dr. Joia Crear Perry. Good to see you again here on BNC. Let's talk more about this concept of weathering. I got to be honest, I've given birth and I've never heard of this. Done dozens and more than dozens of interviews, never heard of this. How much is this really impacting Black women who are giving birth?
Well, you know what I love about the concept of weathering, and thank you again for having me, is that it helps us to understand that although we might look beautiful on the outside, we say these phrases, Black don't crack, and Black women are magic, and Black women are amazing, and we have this strong Black woman trope. On the inside, the stress of racism, the stress of patriarchy, the stress of sexism is hurting our organs. When we have to worry, like I have to worry about my 10-year-old son playing outside with a toy gun, that means my heart's pounding, my adrenaline's racing, so that causes my insides to weather. So that's where the term weathering comes from, this idea that the harms that are impacting our body, although we might look great on the outside, are causing us to have premature hypertension, diabetes, obesity, because our body is handling the stresses that it shouldn't have to handle.
Do women from other races have these issues? Chinese women, Indian women, Spanish women, Middle Eastern women?
Well, we have some data that shows after September 11th, when the religion of being a Muslim individual became racialized, right? When people who were Muslim in the city of New York were being threatened and harmed, they had higher rates of preterm birth. So this idea that your biology, your body is impacted by the harms of how people have bias against you and how people see you has been solidified inside of science. We also know that even for white men who are going off into space inside of technology of astronauts, they showed shortenings of telomeres. So any kind of stressor is going to make you have weathering. The fact is, Black women are stressed by both racism and by gendered racism. And so our stressors are constant microaggressions, outright aggressions, and so our bodies are having to deal with those attacks all the time.
So that's probably really not something you can control when it comes to other people's bias against you. So how can you prevent this from happening?
Well, I love some of the experts. In fact, many of them I know, Dr. Corey and Dr. Rachel in the previous segment, talking about the need for decreasing your stress, working on finding ways to exercise, to make sure that you can try to do some yoga, but all those things are very individual. We're also fighting to have truth telling. We need a country that says truthfully, we have had a 400-year history of a hierarchy of human value that we're going to undo. And we're no longer going to harm you in workplace or in your communities, and we're going to ensure that you're safe. So yes, individuals can work on decreasing their stress, but also we need a structural response from government and from institutions to undo the harm that's causing the weathering.
Are there any resources out there that you can give us to help people who are dealing with this?
Well, yeah, there are a lot of places where we can work. There's the Truth, Racial Healing and Transformation, which is a project out of the National Collaborative for Health Equity that Dr. Kell Christopher leads, going to different places, and folks like in New Orleans are working to really have some truth telling when it comes to racism. I don't want to disentangle this concept of weathering away from the structures that cause it. I don't want us as Black people, Black women, to believe that we can it's only our responsibility alone. Finding doulas and midwives in your communities if you're pregnant that provides you with a feeling of safety and social connection is really important. Ensuring that you have a partner or have someone in your family who's with you at all appointments so that you can't be both the patient and the advocate at the same time. Ensuring that that your questions are always answered so that you don't have to worry that you got home from an appointment and you don't know what's going on. Those are the moments that this triggering of stress and racism will cause us to have harm and cause us to have preterm babies, as was mentioned in the segment, and cause us to have higher rates of death and illness.
Well, thank you so much for giving us that information. We appreciate it. Thanks for joining us here, Dr. Joia Crear Perry. Take care. And experts say there is one big thing to remember. It's important to educate providers already in the healthcare system to prevent discrimination against Black mothers. To watch more of our Be Well series, go to bnc.tv and click on Health. We'll be right back after this quick break. This is BNC.
Health Markets.
You're right, Bunker. The Medicare enrollment deadline is almost here. If you're on Medicare and you want to explore your options, the deadline